Welcome back. The Gauteng Premier David Makhura is today visiting clinics and research facilities in Johannesburg to assess readiness ahead of the phase 2 of the vaccine rollout. He's joined by the Health MEC, Dr. Nomathemba Mokheti. The second phase is expected to begin next month. Meanwhile, there have been reported complaints about the transfer of patients from the Charlotte Maxeke Johannesburg Academic Hospital after the devastating fire over the weekend. eNCA's Govan Whittles is joining us now and is following the Premier and joins us for an update. Govan, what is the purpose of the visit to, and the inspection at the Wits RHI? What was that about? We saw a glimpse of that a bit earlier on.
Yeah, Tulasizwe, so the Wits Reproductive Health Institute is 27 years old this year, and it's been taking the lead in researching some of the effects of COVID on some of the studied populations in South Africa. So I'll try to be more specific. Wits Reproductive Health Institute and the Research Center has been looking at whether or not people with HIV are more susceptible to contracting COVID, and once they get it, whether they're more likely to contract a serious illness, end up in hospital or die. And they're also looking at the effects of some of the vaccines given to the mothers and to the children, studying them thereafter, and also looking into the effects of people who have TB and then contract COVID, how they perform. This is all meant to integrate the Gauteng government's response to the coronavirus in terms of what other services it offers to people who are contracting COVID or are susceptible to COVID. But it's also meant to have a look at this old Hillbrow hospital, how it's been converted into this Wits project, and then also how that's been done with a partnership between private funders and the state, but then also how the immediate community in this area have been receiving health services from this facility. And I can tell you the lines snake around the corner. So on the one hand, while they're leading the way in terms of researching the effects of COVID on vulnerable population groups, they're also lagging behind in terms of getting all the services to this dense community here in Hillbrow. And the Premier spoke about a number of issues, and let's just begin with Charlotte Maxeke. He's saying there that he doesn't accept at this point that the fire started because of broken fire hydrants. In fact, he's casting some suspicion on the person who made that comment, Mr. Wynand Engelbrecht from the Fire Ops Group, saying that's a private institute. He's waiting for the official government response to what caused the fire. He says that report should be with him by the end of today or by tomorrow at the latest. And then we received the list from the Gauteng Department of Health saying the major services from Charlotte Maxeke have been transferred across the province. Emergency cesarean operations have been transferred to Florida, for example. So the minister will be there at 2. The Premier won't be with him. Instead, the Health MEC will be with him. But his main purpose of this visit was to see this institute and how it's contributing to the fight against COVID and other serious illnesses.
Yeah, so just on the issue of fire hydrants, Govan, I don't know whether the Premier can easily dismiss that concern, because just yesterday, Kwara Kekana, who speaks on behalf of the Department of Health, was confirming that there seemed to have been challenges with the fire hydrants outside of the hospital, and there was an issue of access to the fire hydrants inside the hospital. So not talking about whether or not the hydrants inside were functional, but there was an issue that arose due to the fire in terms of access. But she did talk about problems with the fire hydrants outside of the hospital. So it would seem to me that there's something to look into there. There's definitely a line of inquiry. The area, though, in Hillbrow, where the Premier has been visiting some hospitals and clinics, is home to a number of migrants from other African countries. What indications is he giving in terms of his government's preparation for the vaccine rollout to include them as well?
Yeah, he's made it quite clear that people won't be excluded from the vaccine rollout just because they're from another country here on the African continent. Instead, he says that the obligation to treat people at the point of service at the health facility will be met before they consider where that person is coming from or whether or not they're registered migrants or unregistered migrants, people here seeking asylum. And that's important because he's confirming that those people who are over 60 years old here in the Hillbrow area will be able to register for phase 2 of the vaccine rollout, and it won't be reserved strictly for South Africans. And let's have a look at what the Premier had to say in his own words regarding how they'll deal with this issue of the migrants, particularly here in Hillbrow.
I am currently focusing on 1.3 million people who are 60 years and above in Gauteng province. We will be guided by national government and the African COVID response on how we deal with migrants who are in our country who may not have the necessary documentation. But my priority now is to go to the townships and ensure that the townships and suburbs in Gauteng and ensure that we find these 1.3 million people. Only 115,000 of them have registered so far. We want to register them. When the COVID vaccines arrive in May, we want to make sure that we have done all of them possibly by the end of June. That's going to be my principal focus. I know the health services in the province, their priority is to stabilize a patient who arrives there, and then they will sort out all other things later. That should be the more humanistic approach. You can't turn someone away because it does not work like that. They don't have an ID, they are dying in a facility, or they want to give birth there, and you turn them away for those kind of things. That's an inhumane way of dealing with issues.
All right, that was eNCA's Govan Whittles reporting there on the visit by Premier David Makhura to various facilities in and around Johannesburg.